And do you have any past GI history?
I've had my appendix removed in a surgery.
When was that?
Over 10 years ago.
All right. Hi, Kevin. My name's Kat. I'm the nurse today.
Hey, Kat.
How are you doing?
All
right. Well, I'm going to be asking you a few questions before we start our assessment, okay? How about you start with just what brought you in today?
I've been tired the last 2 weeks. More tired than usual. Just had like a cough in my chest. Just irritates me when I cough. Haven't been able to eat as much recently. Only soup, crackers. That's pretty much it. Last 4 days I've had a temperature of like 99 to 100 degrees. Not feeling good.
So do you feel like, did it worsen? Is that kind of what brought you in here? Or is it just the prolonged?
I can't. Yeah, it's prolonged and I can't get it back down. And it's not gotten better.
Okay, I'm sorry to hear that.
Oh, thanks.
So this chest pain you're talking about, you said this, discomfort, this
cough and chest pain.
Yeah, can you explain that a little bit more?
Well, when I cough, that's when it bothers me a lot. Hurts just right there.
Can you explain the type of pain?
It's tender. And it's kind of sharp.
Yeah. Okay. With that cough, do you feel like it's productive? Are you coughing up any sputum, any mucus?
I do cough up stuff, yes.
Okay, so it's been productive.
Yeah.
Okay. So have you been feeling shortness of breath with this illness?
Yeah.
All the time?
Just
certain activities?
The more activity I do, the more my breath is less. Not getting as good breath. The more activity I do.
Does your respiratory rate kind of increase, or
it's
any other symptoms?
Yeah, I wouldn't say wheezing, but I'm puffing harder.
Do you smoke cigarettes?
No.
Have you ever in the past?
Yes.
Okay. How long ago did you quit?
2 years ago.
Okay. Good for you.
Thank you.
With your living conditions at home and your work conditions, do you feel there's anything there that might affect your breathing? Any exposure to anything?
No.
Okay. And is there any family history of any respiratory illnesses?
Heart attack, if that counts.
Cardiac history of that?
Yeah. Grandmother, father, and uncle have had heart attacks.
You don't have any personal history though yourself?
Personally,
of heart conditions?
Not that I know of, nope.
Okay. When was your last, 3 things here, TB, tuberculosis test, chest x-ray, or flu vaccine?
TB test, do they test that at every annual visit?
Not every annual, but they do test every couple of years. It's where they put the little
3 or 4 years ago.
Okay. And it was negative?
Yeah.
And have you ever had a chest x-ray?
No.
No. And have you received the flu vaccine this year?
No.
Have you ever received?
No.
When you're sleeping, do you feel like you need to use more than one pillow at night? Do you feel like you can't get comfortable laying flat?
I feel like I breathe better if I prop myself up.
How many pillows do you usually use?
2 pillows at least.
Has that just been with this illness, or is that in general?
Only since I've had trouble breathing.
Okay. And do you feel that you tire more easily?
Yes.
Yeah. Have you ever noticed a blue or ashen color to your skin, especially when you're short of breath?
Maybe paler. Color is not as good.
And how about swelling? Have you had any swelling in your legs or your feet?
Sometimes in the feet.
Okay. Do you ever awaken at night with the need to use the bathroom to urinate?
No.
No. And what about any leg pain or cramps?
Just the feet sometimes, and sometimes in the chest, like I was saying.
chest cramp or
Uh,
just the tightness?
tightness, cramp, the shortness of breath, everything feels constricted, and then the feet, they just hurt when they swell.
Do you have any, have you noticed any new sores or lesions on your arms or legs?
Maybe legs from time to time, more like the feet area though, not arms.
Arms, alright. Or any swollen glands that you've noticed yourself?
Not that I've personally noticed. No.
Other than seeing that, seeing that you're more pale, have you noticed any other skin changes?
Not that I'm aware of.
Okay. And are you taking any meds currently for anything?
No.
No. Have you been taking anything for that temperature, for the 9900 temperature? Have you been taking Tylenol, Motrin, anything?
I took
that?
some Tylenol just for when my temperature was going higher, but I can't maintain it at a lower temperature. So I just, there's nothing else I've done.
Okay. And then in terms of, you're saying your appetite wasn't as good. Have you been nauseous at all? Or vomited?
Not much nauseousness, but no vomiting. No.
Is there any certain foods that you can't tolerate, or is it just the lack of appetite causing you to?
Or lack of appetite.
Okay.
I can tolerate most foods. I just not that hungry
Mm-hmm.
recently.
And then if you don't mind me asking, how often do you have bowel movements?
Once or twice a day. Yeah.
Do you have any past GI history?
I've had my appendix removed in a surgery.
When was that?
Over 10 years ago.
Alright, just lastly, take me through what you've eaten in the last 24 hours.
Not much. Like soup broth and crackers. Drink water, juice. Maybe not even have a meal. Just like skip a snack. So not much.
Any other comments, concerns, any questions?
No.
Alright, so then I think we can move into the exam room and I'll meet you in there and we'll begin the assessment.
Okay.
Alrighty, I'll see you then. So let's begin with inspecting your chest. I'm looking just to see that it's symmetrical. I'm looking at the costal angles, the angle of the ribs. I'm looking at the respiratory muscles. Okay. And now can I ask you to turn and put your arms above your head? I'm looking that the AP diameter is the same as is half of the transverse diameter. If you could turn and show your back, please. Good. Turn back to the front. I'm just checking your skin for any signs of pallor, cyanosis. I'm looking for overly apparent ribs, superficial venous patterns. Can I see your sides again? Arms above your head and turn. And then the other side. And can I have you show your back to me again, please? Good. Come face forward. I'm just going to feel for your pulse on your wrist, okay? While I'm feeling the pulse, I'm also monitoring respirations. Okay, good, thank you. I'm going to shine this light on your chest to monitor your respirations. I'm noting your respiratory pattern and rhythm. And the chest expansion. Good. Can you look ahead for me and just breathe normally? I'm listening for any wheezes, stridor, nasal flaring, pursed lip breathing, or any cyanosis, which none is present. Okay. Can I just have you put your 2 index fingers together, back to back, like that? And I'm looking for any clubbing that would be present in your fingers, and there's not. I'm gonna palpate now your chest, okay? So just keep breathing normally. Okay. And now if you could turn so I could assess your back as well. And do the same. Okay. Now I'm going to stay facing that way. I'm going to place my hands at the bottom of your 10th intercostal and just breathe for me. Once more. Good. And now turn around and face me again. I'm going to do the same. And take 2 deep breaths. Good. Okay. So now I'm going to have you face your back towards me, so turn. Okay. I'm going to place my hands on both sides of your back, and I'm going to move them down. Every time I move my hands, I'm just going to ask you to repeat 99 slowly for me, okay? And begin.
99, 99, 99, 99.
Good. And turn, and we're going to do the same thing, but on your chest. Whenever you're ready.
99. 99. 99.
Okay, so now what I'm going to have you do is when you turn your back towards me, you're going to tuck your arms across your chest and put your chin down. Okay? And I'm going to tap my finger along your back. Okay, and turn and face me. And now I'm going to do the same to the front, but just keep breathing normally. And now if you put your arms up over your head, and I'm going to do the same to your lateral side. And if you turn the other way. Okay. Now spin it back around. I'm going to have you do the same again where you cross your arms and you tuck your chin with your back facing me. I'm going to have you take a deep breath and hold it and release when I tell you, okay? Take a deep breath, hold it. Okay, and exhale. Okay, and then take a deep breath in the same position and exhale and as much as you can and hold it. Chin tucked in. Okay, breathe normal. Okay, so now we're going to repeat the same on the other side, okay? So, take a deep breath and hold it for me. And breathe normally. Okay, and take a deep breath again and exhale as much as you can and hold it. I'm going to measure it. I'm measuring for the diaphragmatic excursion. This should be 3 to 6 centimeters, 5.5, and 5. And because of the liver, the right side should be higher than the left side. Okay, so now I'm going to have you tuck your chin in and cross your arms like you did before. And this time I'm going to listen with my stethoscope. So just breathe deeply and at a pace that's comfortable for you, okay? And turn and face me, please. And place your arms above your head, please. And face the other way. Okay. Now I'm going to have you repeat 99 again, but I'm going to listen with my stethoscope as you say it. We're going to do the front, the back, and the sides. Okay? We're going to begin with the back. Turn again. Just say 99 at a slow pace comfortable for you.
99, 99, 99.
And now turn to the front.
We're only on 1 of 4. You ready?
Yeah.
99, 99, 99, 99, 99,
99.
99.
The right so that they can see her. Please whisper 1, 2, 3. Three more times. Good. And now turn and face me, please. We're going to do the same thing. Okay. Now face your back towards me again, please. This is the last time. And now I'm going to have you say E. Okay. Begin.
E.
Okay, and face me. Alright, last time.
E. 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 E.
Okay. I'm gonna assess your heart now.
Okay.
I'm gonna start with shining the light on your chest, and I'm looking at the fifth intercostal space to look for your apical impulse. I'm now gonna palpate. Okay, so I'm gonna just lay my hand at the apex of your heart. Feeling the apical pulse and the base of your heart. Moving near the left sternal border to make sure that I don't feel displaced or widened pulse. Okay, so shoot. And that was here, right? Okay. Now, at the point of maximal impulse, I'm going to feel your apical pulse. And I'm going to ask you to turn your head to the left, and I'm going to feel your carotid artery at the same time and make sure that the pulses are simultaneous. If you turn your head now, please. Great. Okay, just look ahead with your hands to your side. I'm going to make some marks to outline to estimate the size of your heart, since we don't have a chest x-ray here. So just keep your hands there. Okay, and now we'll start from this side. Okay, so now I'm going to measure, and I'm going to record the findings. Okay. 2, 4, 5, and 7. It's all within normal size. Okay, now that we're sitting up, I'm going to have you lean slightly forward, and I'm going to listen to your heart sounds now. Lean slightly towards me. Good. First, I'm going to listen to your aortic valve, your pulmonic valve, your second pulmonic, tricuspid, and the aortic. I'm going to go through the same sequence, but with the bell of my stethoscope. I want to ask you to turn your head to the left again while I listen to your aortic valve. I'm going to, and listen for the apical pulse, I'm going to feel your carotid. Okay, take a deep breath in. And exhale. I was listening for your S1, making sure that it's simultaneous with the carotid pulse. I'm going to do the same thing again. I'm going to have you inhale and then exhale and hold it, okay? And when you're ready. And I'm focusing on S2. I don't hear any S3 or S4 extra sounds or any murmurs. It's going to assess for your lymph nodes, your peripheral vascular system. Just looking to see if I can notice any lymph nodes from here, anything enlarged, redness. Okay. Now I'm going to palpate first slowly, softly, and then I'm going to increase the pressure as I move along each spot, okay? Just tilt your head forward for me. Tilt your head forward, up again. Okay. Next, I'm going to feel on the cervical. And submandibular. Okay, now I'm going to assess the lymph nodes in your arms. Okay? Okay. Okay. And now, I'm sorry if this is ticklish to you. Okay, and now I'm going to move to the other side. I apologize if it's ticklish. Thank you. I'm going to feel your pulses. I'm going to start in the carotid, doing one at a time. Good. Now the other side. Now I'm going to feel your brachial pulse. And the other side. Okay, now the radial. And this side. I'm going to listen for 30, count for 30 seconds, okay? want to feel both radial pulses at the same time. Good. +2 bounding. Now I'm going to ask you to move to the table for me. I'm going to assess your popliteal pulses. So if you could lay with your head down on the bed for me. Sorry, your face facing down. And I'm going to bend one leg at a time, feeling for your popliteal pulse, okay? Just relax. I'm going to start with your left leg. Good. Now the other. Great. You can move back to the chair now. And I'm going to assess your tibial pulse and then your dorsalis pedis. This leg first. Now this is your dorsalis. Okay. And then the other leg, please. Okay. Now we're going to get a blood pressure, okay? So if you put your arm out for me, we're going to start on this side. I'm placing the arrow over your brachial pulse. Okay? Just rest your hand. I'm going to place the bell of my stethoscope over your brachial pulse. And we're going to inflate the bell. Okay, 131/72. The right arm tends to be higher. It can be higher than the blood pressure we get on the left arm. So I'm going to take it on your left arm now as well. Okay. Brachial pulse. We're going to place that arrow over. Rest your arm. And placing the bell of the stethoscope on your brachial pulse. (128/72). I'm going to ask you to move to the bed for me again. So I'm going to use this light and I'm going to look at for any jugular vein distension. Look the opposite direction, please. Okay, and now face me again. I'm going to look for your hepatojugular reflex. So just keep breathing normally. I'm going to apply pressure to your epigastric area. As I do this, I see that your jugular vein increases, and as I let go, it slowly decreases. I'm going to take my light now. Please look away to the left. And I'm looking for jugular vein distension. And now turn the other side. Okay. We'll place one ruler where I see the largest rise of your heart. Okay. 11. Now I'm going to feel for your hepatojugular reflex. Okay. I'm going to push down on your epigastric area. I'm going to watch as your jugular vein rises. And as I let go, it quickly returns. Okay. Now I'm just going to assess overall your skin. Make sure that you're getting adequate oxygenation. There's no varicose veins. There's no edema. We have equal pulses bilaterally at the lower extremities as well. The texture's all the same. Okay, and then capillary refill. Less than 3 seconds. Okay, now that you've emptied your bladder, I'm going to assess your abdomen. I'll begin with my light. Well, I'm eye level. I'm assessing the skin, make sure it's consistent color with the rest of your body. Looking that it's flat. Noting any venous patterns. I see 3 scars, one below the umbilicus, another about an inch below the umbilicus at the midline, and one in the lower portion of the left lower quadrant. I'm noting that the umbilicus is inverted. I'm going to assess behind your head now. Take a deep breath. And knowing everything's flat, symmetrical. I don't see any pulses. I'm going to listen before I palpate because I don't want to interfere with the bowel sounds. Begin by listening to all 4 quadrants. Active bowel sounds, all quadrants. I'm going to listen to the liver now. Making sure there's no vascular sounds. And then the spleen. With the bell of my stethoscope, I'm going to listen to the epigastric area. And the umbilicus area. Listen to the aorta. renal arteries. And the iliac arteries. Good. Now I'm going to percuss the quadrants of your abdomen. Okay. Now I'm going to percuss your liver. Or change this to dullness, I'm marking. And then from the lung area down. Or change this to dullness, I'm marking. Now with my ruler, I'm going to measure the distance. 7 centimeters. Percuss the splitting gastric air bubble for tympani. Now I'm going to use light palpation in all the quadrants to sustain painful or tender areas. Okay, now I'm going to apply moderate pressure. Okay, I'm going to go all quadrants again, and then we're going to move to the liver and the spleen. Liver. Good, it feels nice and smooth. And now the spleen. And we're going to feel the umbilical ring with one finger. Okay. I'm going to ask you to separate your arm a little bit here. I'm going to put my left hand under you. Okay. And then with my right hand, I'm going to feel for your liver. And I'm going to bring my hands together. Take a deep breath and hold it. Firm, smooth, even, non-tender. Good. Now, I'm going to reach across, putting my left hand under your right side. And I'm going to go just between your costal region here. Take a deep breath and hold it. And I don't feel the gallbladder or the spleen, which is good. All right. Now I'm going to assess your kidneys one at a time. Okay, we're going to start with the right one. So I'm going to put my right hand under your flank. Your right one, sorry about that. My right hand under this flank, okay? And push both hands together as you inhale. And exhale and hold. Okay? Now we're going to do the same thing on this side. Again, take a deep breath. Exhale. And hold. Okay. Now, I'm going to palpate for your aorta. I'm going to use my fingers here. And my thumb. And I feel the aorta pulsating. Okay, so So now I'm going to assess for your abdominal reflex. Okay, I'm just going to use this end of my hammer. Alright, just breathe normally. I'm going to go from the umbilicus out to each quadrant. Okay, and lastly, we're going to do fist percussion. So that's for your kidneys. So I just need you to sit up and face your back this way.
This one?
Like put your head towards the window for me. Okay, so my hand's gonna go over your lower flank. When I hit my hand with the fist, you tell me if there's any tenderness. Any tenderness?
No.
Okay, good. So you can turn around now. That completes the assessment. Is there anything else you'd like me to take a look at today?
No, thank you.
Okay, I'll meet with you shortly with the results, okay?